They go to sleep medicine for the apnea, ENT for the throat, maybe GI later on for the reflux, and nobody actually ties the whole picture together. Another reason this matters is body positioning and timing. Reflux is often worse when you lie down, especially after a large dinner, alcohol, chocolate, peppermint, fatty foods, or eating too close to bedtime. Sleep apnea is also worse lying flat, especially on the back. So nighttime becomes the perfect storm. Reduced muscle tone, possible reflux, airway narrowing, nasal congestion, alcohol, late night food, and then the patient sleeps terribly.